TV streaming live now.
We have Nintendo on.
Hi guys. Hi Kathy.
Hi,
Hi Sean.
Nintendo.
How are you all?
Good, thanks. How are you?
Good, good, good. Thank you. Jess, it's an early morning for you.
It is an early morning for me, but you know, and now that I've had a couple of sips of coffee, I am all good.
Cool.
I enjoy the mornings. Catherine and Sherman, I actually have an 8-month-old baby here, so mornings are where that's like, you know, that's the time you get before the baby. It's my time.
Yeah. Okay, you're an old hand at this thing.
I'm just going to try and relocate to a quieter office.
Good luck.
Good day, guys.
Hello.
Hello.
How are you?
Good, thanks, and you?
Wonderful. Kolani from Klerksdorp, South Africa.
Hey Kolani, how are you doing?
Hey, doesn't help to complain, Ntando.
Yeah, man.
As you can see, I'm logging on from my vehicle. Our offices are busy being decontaminated as I speak.
Ah.
Oh yeah.
Yeah, we picked up 2 cases of COVID from 2 of the officials.
Okay.
Yeah, man.
No, we make do with what we can.
Sure. No, we'll soldier on. Thanks.
Please.
So we're at the top of the hour. We are live streaming, everyone. So I will just give maybe 1 more minute, Tando, for Nandi to get on. And Tando, you are a co-host now, so you should be able to move through things. Great. Well, I'm going to go ahead and resume recording, and Nandi and Tando, over to you.
Fantastic. Thank you, Jess. And welcome, and thank you everyone for joining. My name is Nandi. And thank you, Jess, for waking up so early in the morning. I know it's about 6 a.m. in the US, and thanks everyone for joining. So my name is Nandi. And hello. My name is Nandi, and I'm with AVEC as the Regional Stakeholder Engagement and Advisor, and I'm based in Johannesburg. Again, welcome to today's Research Networking Zone webinar entitled, Do Africans Need COVID-19 Research?, which is part of the AIDS 2020 conference. In today's session, we have partnered with the Advocacy for Prevention of HIV and AIDS, also known as APA, and we are hoping to have a conversation between researchers and advocates to really deep dive into some of the issues and concerns that have been raised by various groups about the conduct of COVID-19 research in South Africa, Africa, as well as globally. Before we start, I'd like to just go through some housekeeping rules. So please feel free to use the chat function or tab to write down your questions or comments to our panelists, but also feel free to raise your hand if you'd like to engage with our panelists directly. Please also note that this session is also being broadcasted live in our AVEC YouTube's page, and we'll also be taking questions from that platform as well. I would now like to introduce our lovely panelists. First off, we have Mr. Ndando Yola, who is the co-founder of APA. He's also a member of the VARG and a steering committee member of AFNI. Next up, we have Dr. Kathy Mngadi, who is who qualified as a medical doctor at the Nelson Mandela School of Medicine almost 30 years ago. She has been working with HIV and TB prevention for 16 years with a strong focus on HIV vaccine trials with the HIV Vaccine Trials Network. She joined the Oram Institute in 2018, continuing work in the Imbogodo study and currently in preparation for observational and possibly COVID vaccine studies. She's passionate about working with communities within the research, which is research-placed, and is a strong proponent of continuous community support by site community teams and CABs, even in between studies. Dr. Mngadi is also a PI and protocol co-chair of the HV10705 study, also known as the Imbogodo study. We also have Dr. Sherman Padayachi. Dr. Sherman Padayachi is the principal investigator based at the Sechaba Research Center in Soshanguve. He's an early career stage investigator who has worked on HIV and TB clinical trials, including HIV vaccine trials. He got his qualifications from the University of Pretoria and is currently completing a master's in medical law through the University of KwaZulu-Natal. Dr. Padayachi is a principal investigator for the Oxford COVID-19 vaccine trial at the Sechaba Research Center. And in the years that Dr. Padayachi has been involved in vaccine research, he has immersed a wealth of knowledge in community engagement, operational planning for trials, and safety management of trial participants. We also joined by Mr. Xolani Mdaweni. Mr. Xolani Mdaweni is the deputy co-chair of the Klerksdorp CAB, which is part of the Oram Institute, and he has been part of this CAB for more than 6 years now. And last but not least, we are also joined by Ms. Fanny Swashiba. Ms. Fanny Swashiba was a volunteer in a study known as the ECHO study, which was a study looking to see if there was a relationship between hormonal contraceptive use and the risk of HIV acquisition amongst women. I'd like now to extend just a warm welcome to our panelists, and we'll now hand it over to Mr. Ndando Yola, who will lead the discussion. Over to you, Ndando.
Thank you, Nandi, and a very good afternoon to everybody, and very good morning to those who are joining us from the US. And this is a conversation, a very important conversation, which is part of what we call the research literacy networking zone, right? Which is a side meeting that usually happens within the AIDS conferences. And some of you, or if not most of you, know that this week we were supposed, at least some were supposed to be in the US attending the AIDS conference, which last happened in Amsterdam, but because of COVID, and which has really changed how we do things, we have had to have this conversation in the comfort of our homes, and people like Xolani having it in the comfort of their car seats, and also because of COVID as well. So we really welcome everybody who is joining us on Zoom and those who are joining us on YouTube. And we are really going to have a very important conversation, which has really been making lots of rounds. A lot of things have raised a lot of conversations, I think, as a result of COVID. And this conversation, even though most of us and most of the people that we are working with here have really been having this conversation that we're going to have today, because of our work in HIV, TB, and other health issues that are affecting us. But I think it has somehow, for some reason, gained a lot of attention during COVID. So we really are having a multidisciplinary group of people who are from doctors to community members who are involved in research, as well as somebody who is participating in a trial. So we're just gonna quickly have a go at it, and probably this is not the first, and in fact it's not the last of this conversation, so that we can really talk about these issues. When people raise questions about why research is happening in certain parts of the world, and particularly in Africa, it is important for us to engage and have open conversations so that we really put each other into a perspective about why we're doing research. And we're going to start with the doctors who are involved in research themselves, and we'll start with Dr. Kathy Ngadi, and just briefly, share with us why is it important that South Africa and even Africa, especially in the case of COVID, we have to participate in research. And feel free to take experiences from why we actually have been involved in HIV research, or even in any other research that you have been part of. Over to you, Dr. Ngadi.
Thanks, Ntando. So I think it's very important as Africans that we do participate in research. From a regulatory point of view, if a study is done in another setting, let's say the US, and it's done amongst US citizens, it's not necessarily generalizable to other populations in the globe. There are differences between people that can make a study product more or less effective in an individual or in a population. So we do also need to have African scientists contributing to the studies that are happening across the globe, so that they do have our input, our perspective, and our contribution to the scientific body of knowledge. And for that to be shared with our community, so that when we hopefully find a solution, it is applicable to our African populations as well. So that's why I think it's important for us to participate.
Thank you very much. I think that is very important. It has to be applicable into our African populations, all the solutions that we are looking for. Thank you very much for that, Dr. Ngadi. And Dr. Padeachi, you are involved directly with one of the clinical trials, and maybe you can share with us some of that trial, some information about that trial, and really also contribute to the reason why you think, in fact, if you think we should, and I actually think that you should, you do support that we should be involved as Africa, as South Africans, or even as the other developing parts of the world in research to solve the health problems that we are faced with, and particularly the one that we are facing today. Just to remind everybody, we are having a conversation along a research literacy networking zone, which is a side conversation, a very a relaxed conversation that usually happens as part, in fact, it is happening as part of AIDS 2020, which is a conference that most of us were supposed to have to attend in person. Over to you, Dr. Padeachi.
Good day to everybody. Yes, I do believe that we as Africans, as South Africans, it's really important for us to be a part of this research. So, I mean, COVID-19, it's a pandemic. It's been affecting the entire globe, and it's been affecting all South Africans. It doesn't choose race, culture, or gender. And that is why it is critical that a COVID vaccine trial is targeted at all populations. And our site in our research center in Soshanguve is currently recruiting for the COVID vaccine trial, as you've said. And our immediate catchment area population is predominantly our Black community. But we have decided to extend beyond our immediate catchment area to include a disease population reflective of our larger South African community, which is affected by COVID. So yes, the early phase trials for this vaccine trial were tested in the UK, started in Oxford University, and the trial has now been extended into South Africa. And I think we need to be included in this conversation. We need to be included in this community effort to combat the pandemic. My apologies, we're having a site announcement.
No, that's fine. We understand. That's what COVID is making us go through.
Yeah, so from my side, definitely, I think as Dr. Mngadi said, I think it's really important for us to be part of the global effort to combat this disease.
Yeah, and in fact, I think we are in a global world, and a lot of things that are happening across all sectors or across, any other issue is happening globally, because the world, because of even social media, has become very global today. And unfortunately, one of the things that we've had to experience as a result of being part of a global community is that everybody is free to share their views, and share a lot of information that we have, that it really makes us to be part of this conversation. So we are taking this conversation and hearing from somebody who is what we call a community advisory board member in a research site in Northwest, and that is Tolani Mdaweni. Tolani, what are your thoughts as somebody who works with communities and works with researchers, on the importance of why we should be part of the global research, like the doctors have told us?
Yes, thanks, and Dando, and good afternoon and good morning to the team there. Yeah, indeed, it is very important, I think, coming from a community-based perspective, that we participate and we ensure that we do actually roll out such research in Africa, and maybe in South Africa to be particular, because Ntando, in the communities that we are residing in, there's still a lot of misconceptions regarding the COVID-19 itself. There's still a lot of people who are not knowledgeable about this particular virus, how it is transmitted, whether it is for real, whether, the actual preventative measures that we are actually employing, are they really the right preventative measures? Because there's so much unknown about the particular virus. But as we are seeing, as time is moving on, the surge in our areas, it's becoming alarmingly a lot. It's just increasing on another scale. And we are trying to flatten this so-called curve, but we don't see any curve flattening. Actually, we are seeing a spike. As I just spoke earlier with of the particular topic with my other colleague, we just had an announcement today. One of our ward councillors in JB Max passed on this morning due to COVID-19 related illness. Just last week, a member of the executive council, I mean, this is a high profile people in government, just passed on, the MEC of cooperative governance. So it tells you that actually it's not only the layperson on the street that is being affected by.
All right. Yeah,
pandemic,
I hope.
But each and everyone, yes.
Yes, continue. We just lost
Yes. So that is the big challenge that we are having. So like I'm saying, like never before, I believe we do need this particular research to happen over and above this issue that, you know, in order for us as people, especially on the community, to have an element of understanding, an element of ownership, and then an element, you know, of becoming co-creators of our future. We need to be participating, we need to be engaged, we need to be involved in research so that we can overcome such viruses.
Thank you, Xolani. Very important points that you are raising. You know, speaking to some of the principles that are important as part of research, that, you know, research has got to be co-owned. And it shows us a partnership that really happens between researchers, as we have doctors who are involved in research, and communities. But most importantly, and some of the people that are, you know, are very key in any research process that answers exactly the questions that we are talking about, given the fact that you know, there is a lot more knowledge we need to have around this, and therefore we need people to participate so that they can assist in really answering these questions. And one of those people who is doing that actually is Faniswa Shibo, and it would have been great to see Faniswa, but I imagine that it is not possible. But Faniswa, can you hear us?
Yes, I can hear you.
Oh, there we go. Good to see you, Faniswa. And as somebody who has, you are even having your mask on, as somebody who has participated in an HIV-related trial, can you share with us why have you thought, you know, it is important for you to take yourself into a research site or research center and offer yourself to be a trial participant?
Good afternoon all. I believe that scientific matters are always accurate. So for me to be on the study was phenomenal. It was a wonderful experience for me to involve myself onto the study. Yeah.
Wow, wonderful. And what is it that really motivated you to join a study? And what are some of the experiences that you were having from the community when they learned that you are part of a research study?
Some of the things, they had questions asking me, why would I involve myself in the study? Because actually they wanted to test if is it how long will it take for me to be infected with the HIV virus and everything. But for me, as I said, I believe that scientific matters mostly to me. But yeah, it has been good for me to involve myself on that study.
Thank you very much, Faniswa, and you're really making a very good point that actually science matters. And what are some of the things, let's go back to some of the doctors, what are some of the examples that you can make where science has really contributed, especially in our context as Africans or even as South Africa for that matter? Any quick examples where you can share that actually for this reason we're able to have solutions because of science?
Well, thanks, Ntando. That's a very good question. And you know, most of us or some of us have not necessarily lived through a pandemic or an epidemic before. In South Africa, we are still in the HIV epidemic, and we've got really good treatment that is available, but we still are seeing, you know, a phenomenal amount of new cases per day. And we have also seen that the people who are most affected are young women between the ages of 15 and 24. And that is why it's still necessary for us to really find a safe and effective HIV vaccine, because this would have an impact, even if it was partially effective, of reducing new infections, possibly by, you know, between 5 to 28 million new infections could be prevented with the right coverage. So we have some experience, but We also need to recognize that for all of the vaccines that are offered in our immunization program, starting from neonates, you know, children that have just been born, all the way through to adults. So we're looking here at measles, mumps and rubella, polio, all the way through to adults where we've got HPV and hepatitis vaccines. All of these vaccines have gone through this exact process. And the reason that we don't see cases of polio and we don't have an epidemic of measles and mumps is because people like us have volunteered and taken part in these trials before to find a safe and effective vaccine that we receive as children and maybe later as adults, and we are protected from those diseases largely.
Yeah.
The other point of reference may be a flu vaccine. And that's a good example of a vaccine that may not be 100% effective, but that can reduce the seriousness of an illness. And you know that the influenza pandemic annually has got death rates in the hundreds of thousands. So this is not a minor disease. And here we are sitting now with COVID that has many similarities with influenza. And I think the default in human nature is to try and look for these comparisons and to placate ourselves with, this is just another flu. But in fact, the reproductive rate, so the amount of people that I can infect as someone who is having influenza is about 0.9. So, you know, just about one other person that I can infect. But if you look at the COVID infection or reproductive rate, it's anywhere between 2 and 5 people that one person can infect based on where you are, because this pandemic behaves differently in different demographics, depending on, you know, the testing strategies and lockdown strategies that different countries have.
No, thank you very much, Dr. Mngadi. And to remind you and welcome everybody, those who are joining us via YouTube and those who are part of us on this Zoom chat, we are looking at your questions and we'll really give a lot of time to talk through the questions. And to remind you, you are joining a virtual research literacy networking zone of AIDS 2020, a conference that usually happens in person, but because of COVID, it is happening virtually. Dr. Pariachi, Sizwe is raising a question on some of the things that you mentioned, and she's talking, and I think you made a point about research of COVID being different in the sense that it is affecting everybody. And Tolani has also told us that actually, you know, from people who are in political leadership and across races, everybody is affected by COVID. And I think Sizwe is asking, did you say that the trials are focusing on Black populations? Do you want to clarify that and maybe even talk about why actually it is, if it is, and why not if it is not? Please unmute.
Yeah, sorry. No, so what I was saying was that our site, which is based specifically in Soshanguve, has a predominantly Black community, but we are actively going to be going out of that catchment area to recruit all demographics, cultures, races, genders, etc. So we were trying our best to be inclusive of all communities and populations. I think to answer one of his questions, which was, does COVID-19 affect the Black community the most? I do not think so. I think that the way that a community is affected by COVID-19 is, as Dr. Mngadi mentioned, is based a lot on your preventative measures in place and the willingness of the community to follow the rules set out, and in terms of social distancing, in terms of wearing a mask, in terms of behaving responsibly, etc. I mean, if you look worldwide, it's not actually the Black community that has the most number of infections. The country that's the worst hit currently is the United States of America. And however, having said that, even though we're not the worst hit country, our country is still badly hit. And it still is something that we need as a community to draw together and work together to fight against. Because I think if we want to be left out of this fight, we risk not reaping the benefits and the global benefits of finding a solution to this problem. So I'm not sure if that answers Sizwe's question.
Hopefully that really helps. There are a lot of questions. And in fact, whilst we're talking about research, again, you're joining us from the Research Literacy Networking Zone of AIDS 2020. We're seeing your hands. I see Yvette's hands. We're going to give an opportunity to be able to ask questions. And Nandi, you'll help me with some of the questions that I'm not able to see. But anybody, this is for anyone's take, where do you think it is coming from, the concern about research happening in Africa, and how do we address this issue? Anyone who has a take on this?
So, Ntando, if I may,
Yes.
From my perspective, I think that we need to do a lot more work in terms of research literacy. We have sites all over South Africa, and each site has a catchment area, but there are always populations or people that may not be included in that catchment area. We are also limited by budgets that we have. So we have community staff that go out into the community to engage with people one-on-one or in groups. But in fact, it's virtually impossible to educate each and every South African on a face-to-face, individual basis. So there's always people that don't benefit from the education and the awareness that we do. And now with social media, people have access to global input. Yeah. And I think there's also some concern around the inability to perhaps discern opinion from fact. And also scientists are notorious in the sense that we don't always speak to people about the science in a way that they can understand. We have our own scientific jargon, and that can create a barrier. And that's why we need community advisory boards and people like Vanizwa who take part in our research, who can then interpret it for lay people in a way that they can understand. And we also require the advocates of the community to work actively with us to point out where we are falling short and to assist us in communicating with the population in a way that they can understand the science.
So science cannot just go it alone. We need everybody to be part of the conversation, to be part of the participation, in the process. And it's just gone about 30 minutes since we started, and we're going to open opportunities. I see Yvette, I see Ernest, their hands are up, and anybody else who would like to join them and raise their hand, like Molefe, to ask questions and contribute in this conversation, please feel free, and we're going to give you that opportunity. I'll quickly give to Olani, and I see that Faniswa has also had a particular, remark around the fact that Black communities are more vulnerable than other communities. And I think in a South African context, we know because of the inequality that we are facing as a country, which is why it is also important that, you know, we have to be part of these processes. Whilst we are fighting the inequality, the social injustices that are happening, it doesn't mean, we do need time to be able to fight that. And therefore, when we are affected the most by a pandemic or an epidemic, we still have to another way of contributing to the processes to take part in clinical trials. Xolani, before we give people an opportunity to ask questions, do you have some of the things that you'd like to share? In fact, I can also share, as somebody who is right down in Cape Town, in the tip of Africa, that the premier of the province, who is actually not a Black person, has reportedly been infected with COVID. And I think it really does tell us that for once or even after a long time, we now have, a public health issue that is cutting across board and affecting everyone, and it is not choosing anybody. It is not respecting anybody. Well, I guess like it is with HIV. What do you have to say for that?
No, definitely. And I think your last input just hit the nail on the head, because, like Dr. Padiachi is saying, it's not a coincidence that since he's operating in that community, that predominantly their clients are Black people, because of the demographic issue, you understand, and also the issue of the socio-economic aspects. Again, they affect us a lot because when it comes to compliance to COVID-19 preventative measures, for example, you tell a person who's residing in a RDP house, which is maybe, I don't know, in terms of square meters, maybe it can be 10 square meters. And then you tell them to keep 1.5 meter physical distance, of which it's impractical, and it becomes a challenge. So hence it perpetuates these infections, and it increases our infections, because it's not like people maybe don't really want to comply, but because of the structural and socio-economic fiber that we find ourselves in Africa, and in South Africa to be particular, it becomes a challenge to deal with these preventative measures. I can go on and on, Dando, because, also, you tell a person who is unemployed, for example, that prioritize to buy a mask, but he'll tell you that, I need to buy bread. I cannot spend 20 rands on buying a mask, whereas I am hungry, and you say, stay at home, don't move around, but then what am I going to eat at the end of the day? If I stay at home, I don't go out and hustle. So those are some of the nuances that we find ourselves exposed to in Africa. Hence, I'm in full agreement with the team that we really do need such a research in Africa.
We definitely do need research from what you are sharing with us. Again, you are joining us on a virtual research literacy networking zone of AIDS 2020. Welcome everybody, those who are joining us via YouTube and those who are part of this conversation. And those who have joined us in person, in this order, we're going to open an opportunity for them to ask questions. But in the meantime, I'm going to give some homework to Dr. Mgade and Dr. Padiachi, because we've been hearing a lot of information that is coming from the World Health Organization. And the World Health Organization has gotten back to us now, telling us that actually it is confirmed that COVID-19 is an airborne disease. And there are a lot of concerns that are coming through because of information that is, coming as we are all learning as part of this COVID-19. But in the meantime, what to think about that? I'll hand over to Yvette. She's going to be followed by Ernest MOSEKI all the way from Botswana, Lucky Molefe and Nombeko Mpongo to ask their questions. Nandi is going to let them in to be able to ask the questions. Yvette?
So if you can go, you can.
Yes, thank you so much. Thank you, Ntando and everyone else for this very informative session. Do Africans need COVID research? I think the question should be, why has research taken so long to engage Africans and African advocates? I mean, we all know that this far, the research is happening in Africa without the engagement of advocates, and also that this is the time for researchers to be open about where and how the research is happening. I heard one of your panelists talking about research catchment areas and all of those things, and that we just cannot have everybody in South Africa understand and know about research. With COVID-19, unfortunately, yes, with how the research and how the education and discussions about research has started in this country, in Africa, we need to engage every single South African or African to be part of the discussion and the narrative and discourse where research is going to go. We know there are different researches going on, but we also know that there are scientists who look down upon our own indigenous research, and how are we going to marry the two? So for me, the discussion is 100 days too late in many of the African countries, 100 days too late for us to only start talking about it, but I'm glad we're having the discussions. And I think research sites and researchers in South Africa should also just be a little bit more patient with South Africans and Africans when they do have issues with regards to research. We all know we are seen as Africans as the dumping sites for research, and how other countries look down upon us. And when these methods become available, these solutions become available, Africa is the last part of the world that gets some of these solutions. So I'm glad we're having this discussion, but I would like to hear much more from our doctors and our panelists about why Africa needs this research, and now, why do we need it now, and how do we get all South Africans and Africans on board? Because this research, as we see the numbers of COVID-19, it's not going to play games with us. Everybody is going to be part of being infected. As some of the modelers are saying, 80% of some of people in countries are infected. Are infected with COVID-19, but we're still talking as if it's an exclusive disease that should only happen to certain people. Now I see the narrative going to, it's also affecting, important people or certain class. Come on, this disease was from the beginning going to affect everybody.
Thank you very much.
That we know that it is airborne now too. And activists did speak about this. Thank you.
All right. Thank you very much. And I think, yeah, you're raising a lot of questions and most important issues around, you're asking why research is only coming now, and at the same time, you're also highlighting that it is important for us to be part of research. And I'm going to request that we just have about 20 minutes before the end of this conversation. Please just get straight to the point so that we can all have an opportunity to engage as part of this important conversation. Ernest, over to you from across the border in Botswana.
Go ahead, Ernest.
Let's allow Ernest, let's unmute Ernest. Ernest, you are on mute if you're trying to talk. All right. I think whilst Ernest is trying to figure that out, let us take it to Lucky.
I'm sorry, I'm actually unmuted, Tando. I can go on. Thank you for the opportunity to speak. This could not have come at a better time when we Africans are actually bearing the burden the highest burden, the burden of the COVID-19. Two things quickly. One, we are struggling at the moment to enroll, to actually offer pregnant women interventions that we know work. And that is primarily because they were left behind, and they're always left behind. And there's no data that was collected for pregnant women. Let us not repeat the same mistake by leaving Africans out of COVID-19 research, because then we will be where we were 20 years ago. We'll find that in 20 years to come, we'll find ourselves where we are today. So it's important. I think what we really need to be saying right now is, because of the speed at which we see a lot of research coming up, when are we getting involved as advocates? When are we getting our communities having an input, a meaningful input in the development of protocols that address COVID-19 issues? Thank you very much.
Thank you very much. Where is the role of advocates and community people in all of the research that is coming into the country? Thank you for being brief. And Nombeko, oh, sorry, Lucky, I had given you an opportunity first.
Yeah, thank you, Tando. Thank you, guys, for giving us this platform. Can you hear me, guys?
Totally, we can.
Okay, thank you for giving us this platform. At the time, community engagement is such a complex issue, and you don't know how to deal with some of the issues, especially now introducing the digital world. But my question straight to the point is to Dr. Padiachi, that what is the uptake of other race group in the study that they're doing currently? Because if I understood him, is that they're trying to expand the horizon beyond Sichaba or beyond the immediate community of Sichaba. So I just want to understand what's an uptake from other race groups now that they've expanded to those areas. Thank you.
Wonderful. And we go to Nombeko again. We are on a virtual research literacy networking zone of AIDS 2020. It is all happening, supposed to be happening in the US, but it's all happening in the comfort of our cars and homes and wherever you might be right at this point. Nombeko?
Okay, good morning, good afternoon, everyone. I would like to know from the community perspective, as a person who is responsible to engage bigger communities, when and how are we going to provide more resources to engage with communities? Because the people in this group, the people that have joined this meeting are the people who more or less have got some of the information. So is there anything that is provided so that we are able to do our job and engage communities in a bigger space?
Wonderful, thank you. Ntombozuko? And Ntombozuko, I hope you are not on mute. We have allowed Ntombozuko to speak, Nandi, right?
Yes.
But it looks like she has disappeared. I no longer see her as a participant.
I think we have quite a mouthful for our doctors to really respond to. And I think one of the things that is also mentioned, I think for Faniswa, which I think is an important conversation that needs to happen, where Nita is asking, you know, where is the voice of people who participate in trials? Should they, you know, how are we making sure that their voices are heard? There's people who basically have said, I want to be part of a research trial. I want to give my time and everything. It is important that as part of the conversations that we're having, we hear from those voices, because these are people, you know, that whilst some of us have really been making sure that we're bringing people on board, but we should have as many voices as possible to those people who participate in trials. A lot of questions for you, Dr. Padiachi and Dr. Mngadi. I think please take any of the questions that you have heard.
So thanks, Ntando, and thank you to everyone for the questions. This sort of communication, this sort of platform is actually useful for us to hear the concerns of the community from the community themselves. And just to remind people that we are members of the community as well. We may not be living where you are, but we try in so far as possible to really understand the communities where our sites are located. So my site is located in Tembisa, and our catchment area is Tembisa and Alex. And one of the things I do as an investigator is to go out with my community liaison officer into the communities that we hope to draw participants from, and to see how people live, to understand what their challenges are. And like Zolani said, you can ask people to to practice physical distancing and hand washing, etc. But if you don't have access to water and you're living with multiple people in small houses in Alex, where a single plot may be divided up to accommodate 20 families, as scientists, we need to understand those dynamics so that we can offer solutions that are applicable to those communities. So I know there's a concern about, or a growing concern about this disease being airborne. And scientists are learning about this disease, and these communications are going through to the communities as quickly as we learn them. And there are missteps that are made by scientists. And in fact, the scientific method is to help us to correct those missteps. So there have been papers published in other fields that have been withdrawn from journals either years or months later, because the scientific method is to always question the findings of scientists to see if it can be replicated in other populations, and to point out where these missteps may have been made. And the advocates have a very big role to play in this as well, because they are able to communicate the concerns of the community to us and point out any missteps. The challenge with COVID for all of us is that it's really moving at warp speed. And when you have a pandemic like that, it's very easy for things to be left by the wayside. So for the question, I think it was by Nombeko about the resources to inform the community, that is also a concern of investigators that are on the ground. One of my requests to the sponsor has been for us to start the education and awareness now. But in fact, all of us are restricted by budgets. We are all restricted by the politics that happen around research. We are all restricted by resources. So I have a deep desire for us to get out there, to have more communications on community radio, television, but we just don't have the resources to do this. And so we are now stuck in a position where we are trying to hire people, but at the same time educate the community. And the truth is that we are restricted. But forums like this will allow us to reach more widely into the community. And what I ask is that for anyone who's on such a forum, when you go back, don't keep that information to yourself. Speak to your family, to your friends, and to your wider community about what you have heard. And one of the restrictions of COVID is that we can't really get out into the community and speak, what with the physical distancing and the things we need to control this infection. So we are also trying to learn a new way of functioning in this pandemic.
Wow. A lot of questions coming through, but thank you to all our panelists who are really contributing as part of this conversation, and even thank you to those who are really engaging through the chat to ask a lot of very important questions. And that's some of the things that you want to pick on, Dr. Padiatri.
Hi, yes, so there was a couple of good questions. I really appreciate the feedback, and I think these are really important questions that are being asked. One of the first ones I think was whether COVID was airborne, and I think Dr. Mngadi did answered that quite well. I think the WHO currently is merely acknowledging that the evidence points that it could be airborne. At this point in time, there's still a lot of research that needs to be done. It's a rapidly evolving situation, and as new things are being learned by us, so it's being put out into the community as well. So at this point in time, we have to try and put measures into place as we learn of the new information. This is not information that we knew 2 weeks ago or a month ago. This is not information that is cast in stone as of yet. It's information that we try our best to control the pandemic with. So as I've said, the evidence points towards it possibly being airborne, and we will have to deal with that evidence as it comes in. I think one of the earlier questions was from Yvette, where she alluded to why doesn't the research come to Africa first or quickly? And I think in the past that's definitely been the case, where Africa has been somewhat left behind due to a number of reasons. But I think in 2020, that's not as much the case as previously been. You know, this, if we just specifically look at this COVID vaccine trial, it started with preclinical phases in Oxford University in the UK, and immediately now it's come before they have even, so as soon as the initial safety data has come in, they've brought the vaccine trial to South Africa. They've taken it to Brazil, countries which are not typically considered first world or you know, Western countries. So that was a great move that we are seeing in research, and we're glad to see that that is happening. She alluded to the fact that how come we don't look at more of our indigenous medications and research some of them. I think that is something that we as a nation, South Africans, would love to see more of. If there is something that works, regardless of where it comes from, why not invest in it and look at it? And as long as we go through the correct testing processes, safety processes, and efficacy processes, I don't see why we shouldn't be heading in that direction. I know that one of the questions, important questions, was regarding the race groups for the study, and could we give them an update on what the current numbers are. Unfortunately, the study's just started. Like literally, we've been enrolling for about a week. And so there's been a great interest from our current immediate community, and also interest, in fact, from the current community. So we're prioritizing them first by enrolling them first into the study. However, I can assure you there is a concerted effort, not only from our side, but from the other sites in South Africa, to definitely enroll and to find a whole different demographic of people so that we have a good representation. So that is definitely something that going forward is really, really important to us as South African research sites.
Wonderful. Thank you very much. We just now have about 5 minutes. Can you believe it? And we're asking a question: do Africans need COVID-19 research? And this is a conversation which is part of AIDS 2020 virtual conference. And we are in the research literacy networking zone, where we are really having very casual conversations, but important ones on very important issues around research that is happening in Africa, like we have always seen. And there are a lot of questions. In fact, one of the things that I actually think we do not really speak about is the question of transformation around research, especially in South Africa. And in fact, very interestingly today, at least we usually have doctors who do not look as brown as the doctors we have in the chart today. And perhaps this is one of the conversations that we're supposed to, to be having as part of research, because a lot of this mistrust is as a result of a question that was raised, I think, by Yvette with regards to research happening from Europe or the US and coming to Africa. And in fact, when it comes to Africa or even in South Africa, we see all of the white researchers who are meaning well, but leading a lot of research. And perhaps this is, the conversation really needs to continue to touch on all of these aspects that are affecting society, because these are contributing to how research is seen. And it was even unfortunate at the beginning of COVID, where we had French doctors making remarks about research happening in Africa. And as I give everybody an opportunity, as in the panelists, to really give us their closing remarks, I would really like for our two research doctors to touch on this issue of transformation in research, which I think Dr. Mngadi has touched on, about the importance of research speaking the language, but I think most importantly, researchers looking more like the people where research is happening, at least in the case of diseases that are affecting those who live in the most unfortunate conditions of our society. So I'm going to give everybody an opportunity, and we will continue with this conversation even outside of the conference. And quickly, please, just 1 minute to all our doctors and our other panelists, Kolani and Faniso. What are the messages that you would like to give us as we conclude this conversation, at least just for now?
Thanks, Ntando. So I do want the attendees of this forum to know that research is undergoing transformation. Currently, I'm working with the Aurum Institute, and previously I worked with CAPRISA, where we have a program from medical school level in terms of clinical scientists to actually draw people in to research. And I think we can't deny the history of our country, where people, a large section of the population, were disadvantaged and are starting now to really get on their feet and get to grips with it, but it's also limited. So when you approach someone who's previously disadvantaged and ask them to go into research, I've mentored some of the Black students from the University of Natal, the Nelson Mandela Medical School. And a lot of their concerns, because when we mentor, we're not just interested in mentoring them as scientists, but we need to understand their lives per se. And many of them are looking to earn money to support an extended family. This may be the first person in the family that has been to university, qualified as a doctor, and has many family members looking to them to assist them. And this is a reality that we can't deny. And so the interest is more in being a clinical doctor, being a specialist, in order to provide for the family, and perhaps not in the field of research. But we do have some excellent researchers, Black, Indian, colored, etc. But it's just not a very widely known phenomenon. And I think that the best advice I can give you is to find a research institute's webpage and to look at the staff that they have. And you will see some wonderful researchers from all sectors of the population that are involved in research in South Africa, at least. Beyond South Africa, the researchers that we interact with are definitely drawn from the indigenous populations. It's like I say, it's just not widely publicized.
Wonderful. Thank you very much, Dr. Mngadi. Dr. Parayachi, your closing remarks on these topics. And one of the topics, within a minute, if you can, that has been raised is indigenous knowledge systems research, because we have seen a lot coming through around this as well.
Thanks. Yes, so in closing, I think I agree wholeheartedly with Dr. Mngadi. I think research is definitely undergoing a period of transformation. I like to think relatively young. So I have been in research for a few years now, but I can tell you when I first joined as a medical doctor at this research institute, we have, they definitely prioritized people of color. And we have CEO Dr. Ahmed and Deputy CEO Dr. Molefe, who took us, myself and Dr. Moelo under her wing and mentored us and made sure that a lot of what we can bring to the table today is due to them. So I think that is part of the transformation, finding young people, doctors of color who are willing to be mentored and who are willing to take up the mantle of research going forward. With regard to indigenous research, I think it is still a growing area. It is very difficult. In fact, before this call, I was having a conversation with Dr. Molefe, who despite being a very senior principal investigator and senior doctor in the field, is not just interested in Western medicine. She has firm beliefs that some of our indigenous products are more than capable of helping in the healthcare setting. However, the infrastructure in place and the investment in place in our country is not at the level yet that we would like and that we would like to see. But that's up to us as a nation to build and to invest further into that. But as I've said before, I would love to see, me on a personal level, love to see more investment into that and more growth in that area.
Wonderful. Thank you very much. And you really spread the responsibility to all of us to really advocate to ensure that, you know, there is a lot of funding because it takes a whole lot, you know, to do this kind of research. Thank you very much. Xolani, your closing remarks, just a minute or in fact less than a minute. 30 seconds. Can you do that for us?
Thanks, Ntando. Yes, I just love the aspect that even the scientists there, the doctors, realize that they are also part of the community. And definitely, you know, once we get that right, then there's very same scientists will understand the challenges that these participants and the communities are going through as we are conducting our research. The African Development Goals of 2063, the NDP of South Africa 2030 talks about universal health coverage. Now, you see, this particular COVID-19 has exposed us that we really need to put all hands on deck towards universal health coverage so that all our people can actually benefit in as far as getting, you know, vaccine and also help in fighting this COVID-19. And hence, we agree that research is needed to actually assist us in ensuring that our people actually, you know, overcome this burden of COVID-19. But with that being said, Ms. Ntando, we believe as community members that, you know, the fight against COVID-19 will not be won in hospital beds or in clinics, but it will be won only in communities. When we involve our communities step by step, as and when we are doing our research. The Oram Institute, the HVTN, you know, the Desmond Tutu sites have actually done a lot. And I want to believe they've mastered this community engagement aspect. And we can use these platforms and these organizations as one of our building blocks, you know, in actually understanding how can we actually further galvanize our community participatory models. Thanks.
Thank you, Colin. Very, very wise words that we all have a responsibility in ensuring that we address health. And it is not only an issue of doctors, it is not only an issue of hospitals, but it is an issue of us all, to galvanize, to advocate, to make our voices heard, and in fact, bring ourselves to be participants in the research, like Fanny Sositobo has done. And you want, Fanny, so do you have any closing remarks for us as part of somebody who is first-hand participating in research?
Yes, I do. I hope that the researchers won't forget the rural outskirts of the cities. Yes. Because, they are more vulnerable into the virus, so they need to be taught more about the virus.
Wonderful. Thank you very much. A very important point that you are bringing there, that research should not only happen in the cities and the townships, should go out into the rural aspects of our communities. So there's a whole lot more to, to do, which is something that Belinda Amatera is also saying, because she is also out in Worcester and is highlighting the importance that, all of this work and all of these interventions should go far and wide. And I think the important message that I think we got today as part of this Research Literacy Networking Zone of AIDS 2020, which I think is a conversation that needs to continue, is that we have a role to play and we should participate in research. So thank you very much. Thank you to Lucky, Molefe, to Nita, who is out in KZN, Yvette Raphael in Gauteng, Nombe Kompongo, Sinazo, Pato as well, and everyone who has raised their hand to ask questions and engage, but to everybody who is joining us on this Zoom as well as live on YouTube. This conversation is going to continue, and we thank everybody and our great panelists. If we were in person, we were going to clap hands for all of you because you've done a very fantastic job to come forward for us to have this conversation. And thank you, everybody. And I will now hand over to Nandi, and we say thank you to everyone and goodbye.
Thank you so much, everyone, for the lively discussions. I know we are 8 minutes over time, so I'm going to be quick. I'd like to give our sincere appreciation and gratitude to our lovely panelists, Dr. Ketem Gadi, Dr. Sherman Pareachi, Mr. Kolani Mdaweni, as well as Fanny Swashisa. And again, thank you to you, Mr. Ndando Yola, for the amazing discussion that you've led. As Ndando has noted, this is this is not going to be the first and only time. This conversation is going to be continuous, and we hope to make sure that we galvanize support. And again, I just want to stress that community engagement is important, and I'm glad that we have these doctors on board who are actively participating and leading some of the research at their respective sites. And we need this community engagement and stakeholder engagement to be ethical, to be meaningful, to be all-inclusive, comprehensive, and to also make sure that we observe the good participatory practice principles that we all are familiar with. So thank you all, and we hope you enjoy the rest of your afternoon. Thank you. And thank you, Jess, and everyone else that has joined.
Thanks, Nandi. Bye.
Bye.